Good day, everybody. My name is Dr. Hussain Nasaif, a senior lecturer at the Royal College of Surgeons in Ireland Medical University of Bahrain. First of all, I would like to thank the Professional Development Unit at RCSI Bahrain for inviting me to give this presentation on the celebration of Health and Wellbeing Day. This short presentation is about bringing awareness to men's health issue. So I'll be focusing on 7 domains. First of all, why it is important to focus on men's health, the engagement of men in unhealthy risky behaviors, and health literacy, which has been proven by findings from several research studies, the common health problems that affect men, and the associated factor, both modifiable and non-modifiable factor, and the common leading causes of death among men worldwide and in the Kingdom of Bahrain. The reasons for men not to engage in early disease detection program and screening program. I also will be presenting findings from research studies that have been conducted by researchers from RCSI Bahrain assessing men's awareness of different health problems, and I will be ending with steps for better men's health. So why is men's health important? And to answer these questions, I think we have to realize that the subject of men's health is frequently neglected in the public health discussion, and there has been less focus on men's health compared to women's health. We also need to remember that there is a gender gap in health since many years, not only in Bahrain but worldwide, and there is hidden cost for neglecting men's health. That neglection of men's health affect the quality of their life, generate more sufferers, and lead to premature death. So when it comes to the prevention and early detection, men often take backseat to women's health, and findings from research study found that men pay less attention to their health than women do. Findings from research studies also found that men die younger than women, and they are more burdened by acute and chronic diseases during their life. For example, men have more chronic diseases than women, and men are nearly 10 times more likely to get inguinal hernia than women, and 5 times more likely to have aortic aneurysm, and this is life-threatening condition. Men are about 4 times more likely to hit by gout, and they are more than 3 times more likely than women to develop kidney stones and other kidney diseases and become alcoholic and to have a bladder cancer. And they are about twice as likely to suffer from chronic obstructive pulmonary disease, a common disease that affects the lung, and duodenal ulcer. This figure shows the men's life expectancy around the globe from 1955 to the present. And as you could see from the graph, men's life expectancy is less than women's life expectancy. Means that women live longer than men. And it's very important to note that men die on average 5 years earlier than women. And this is very worrying actually. In the Kingdom of Bahrain, the overall life expectancy is 77, and the life expectancy for male is 77.8, and for female 78.8, which is 1 year different. But the questions that we need to ask ourselves: why is men life expectancy 5 years less than women? And in another word, why men die earlier? And what are the reasons for these disparities? And to answer these questions, we need to remember that there is a gender gap in health since many years, as I mentioned earlier. So perhaps men's engagement in risky behavior is a contributing factors for lower life expectancy. In addition to, men pay less attention to their health than women do, and generally men does not engage in healthy lifestyles and behaviors in relation to the exercise, diet, maintaining ideal weight, due to several reasons like no time and other family and work responsibility. Men also are more likely to smoke, drink alcohol, and take more risk. According to the report from WHO, about 40% of men smoke as compared with nearly 9% of women. Men also tend to drive faster and involve in more auto accident than female. Men more likely to put off their routine checkup and delay seeing healthcare providers for symptoms of health problems. And this actually may contribute to low life expectancy at birth among men, in addition to other social and economical factors. So let's look here at the top 4 leading causes of death in Bahrain. And this is for the last actually 10 years and does not change. Cardiovascular was the first cause of death, followed by cancer, followed by external cause of mortality and morbidity, and the fourth one is the disease of respiratory system. Men have more cardiovascular, more cancer, more respiratory diseases than women. And men very often die from other external causes like road traffic accident and deadly accident at work places. And this is also another factor that lead to lower life expectancy in men compared to women. So Looking at the incidence of cancer in Bahrain in the period between 1998 to 2002, you will clearly see in this table that male have more cancer than female for most of type of the cancer. And this is also another alarming issue. Male diagnosed with bladder, prostate, liver, colorectal cancer, stomach, lung, larynx, bladder, esophagus, pancreas. And based on the findings from many studies, that there was positive association between smoking and the development of majority of these types of cancer. And as you could see here from these pie charts, I'm looking from my other screen. The top one is the number of new cases in 2020 for male, and the bottom one is the number of new cases in 2020 for female. The situation does not change. Still, men is affected with cancer more than women. So if you could see here the yellow color, my apology, the number of new cases among men with colorectal cancer is 83 new cases, where there was 64 new cases of colorectal cancer among women. The blue one is the lung cancer. There was 65 new cases for male and only 31 new cases for female. With regard to the bladder, the dark green for male, there was 44 new cases, and I could not find anything for female. So most probably there was 0 cases of bladder cancer among female in 2020. And this is also another strong evidence that male is affected with cancer more than female. An information that I forgot to mention in the previous slide, that 1/3 of Bahraini adults smoke all type of tobacco, cigar, cigarette, habal papal, electronic cigarette. And it's clear from this slide from the Cancer Research Center in the UK that there are 15 types of cancer that can be prevented by being smoke free. So the cardiovascular diseases is the first leading cause of death worldwide and in Bahrain, as I mentioned earlier, and there is a strong link between diabetes, hypertension, and dyslipidemia with the development of cardiovascular diseases, which is common in men compared to women. Another important information here that we need to talk about is these non-communicable diseases are estimated to account for almost 83% of all deaths among men in Bahrain, and 80% of all sudden death cases among men are due to unrecognized heart diseases that occur in men. One study was done in the United Kingdom 2 years ago. The family member of men were asked about possible warning signs that their loved one, the man, may have mentioned before his death, and the majority reported that they never indicated, the man never indicated a sign of symptoms. And this is clear indication and evidence that men generally does not talk about the symptoms that they are experiencing for different health problems. The health literacy in men is another important aspect when we talk about men's health and men's awareness of different health problems. Findings from several research studies have indicated that the men had low level of health literacy compared to women. And what health literacy means? It means that the degree that the person have the ability to find the information, understand the information, and use the services available for them to inform their health-related decision and action that they need to take in relation to their health and well-being. So why men does not engage in the early disease detection and screening program, and perhaps the health literacy could be a factor that reduce the men engagement. But several research studies investigated the barriers to screening for early detection of cancer as an example, and the most barrier was the lack of knowledge about the risk factors and the early symptoms of the disease. There are other also barriers have been identified by these research studies, which include men does not have the symptoms, so they don't need to go for early screening. The cost of the screening test, the language, their fear of the results, and the embarrassment, like the colonoscopy or the rectal examination to detect if there is any enlargement in the prostate gland. This is also considered as a barrier in terms of the feeling embarrassed of going further for this type of screening, and not having the insurance and some other cultural beliefs. Also another barriers for not engaging in early screening programs. Let us have here a closer look at the findings from the research studies that was conducted by researchers from RCSI Bahrain. And this is the first study that was conducted by myself and colleagues from University of Bahrain. And this study aimed to assess the public knowledge and awareness of colorectal cancer risk factors and early symptoms. And we have found, in relation to men knowledge and awareness about this disease, that only 1% identified abdominal bloating as a symptoms of colorectal cancer, and only 3% identified lower back pain as early symptoms for colorectal cancer, and only 4% identify the anal pain as early symptoms, and 21% identify loss of weight as an early symptoms of colorectal cancer. And we found also that 44% and 46% of participants, referring to man here, identify lower abdominal pain and changes in bowel habit as early symptoms of the colorectal cancer. And as you could see here from the percentage, the level of knowledge about early symptoms is very low, and this is maybe perhaps a reasons for not seeking a medical advice, and it's a cause actually for late diagnosis of the disease. In relation to the men awareness about the risk factor, we have found also that men had a low level of knowledge about the risk factors, as 2% only identify high fat intake might be a risk factor for development of colorectal cancer, and 4% only identified low fiber diet intake could be a risk factor for colorectal cancer, and 6% identified that being older than 60 is a risk factor for colorectal cancer development, and only 28% identified smoking as a risk factors, and 38% identified family history as a risk factors for colorectal cancer. And recognition of early symptoms and risk factors of colorectal cancer may lead to late diagnosis. And this statistics is from the cancer registry at the Ministry of Health, and the registry is between 1998 to 2007. And if you look at the blue circle in the left hand side, it indicates that 37 of men, when they were diagnosed with the colorectal cancer, the cancerous cells already migrate outside the colon, and 21% when they were diagnosed with colorectal cancer, the cancerous cells is metastatized and spread all over the body, and that might be a factors not being aware of early symptoms and risk factors leading to late diagnosis of the disease, which affect the survival rate later on. This is another research study conducted by one of the academic at RCSI, and was published into 2021. They assess the men awareness of prostate cancer risk factors and early symptoms. And as you could see here from the percentages, they asked them about the high fat intake, the obesity, the family history, and the smoking. 43% were not able to identify the high fat intake as a risk factors, and 38 did not identify the extra body weight or the obesity as a risk factor for prostate cancer, and 48 and 67% of participants were not able to identify the family history and the smoking as risk factors for prostate cancer. With regard to the early symptoms, 43% of the participants were not able to identify frequent urination as early symptoms of prostate cancer, and 49% were not able to identify passing blood with urine as risk factors or symptoms, my apology, for the prostate cancer, and 57% were not able to identify lower back pain as early symptoms of prostate cancer. Prostate cancer affects only men, and it's obvious from the findings of this research study, which is consistent with other research studies around the world, that men had lack of awareness and poor knowledge about early symptoms and risk factor for prostate cancer. And it was to mention also that the incidence of prostate cancer is increasing in the last 10 decades. And this is another study also published in 2020 and conducted by academic at RCSI. They looked at the men awareness of testicular cancer early symptoms. And the shocking findings from this study, that 47% of participants were not aware that the men can get testicular cancer. And in relation to the symptoms, only 1% identified that passing blood with urine could be a symptoms of testicular cancer, and 2% identified that changes in the size of the testis or the scrotum could be a symptoms of testicular cancer, and only 7% identified that scrotum pain could be symptoms of testicular cancer. And this is also another evidence from research studies which indicate that men had poor knowledge and lack of awareness about a disease that affecting them in particular. So to conclude, and based on the findings from the research studies that I have presented, and the incidence of the cardiovascular diseases, the cancer, and the association between smoking and the development of different type of cancer, and the impact of health literacy in terms of identifying the right information and accessing the right services to inform the men about the proper decision that they need to take with regard to their health and well-being. Men yourself are responsible for taking a proactive role and taking the first step toward maintaining and restoring your health through having a regular checkup, know and understand your family history, understand the risk factor, and participate in the screening program, and refrain from bad health habits like smoking and over driving. Another important element, the family support system available for men also help men to change to more healthy behaviors and more healthy choices. Another important aspect is the contribution made by the community, and what I mean here, the NGOs, professional societies, and health academic institutions coming up with a program and community outreach event to promote men's health awareness about different health problems that may affect them. And in conclusion, we are almost finishing 2021 and beginning of a new year. I wish all men in Bahrain and around the world a new year ahead, and thank you very much.